Hey guys, Dr. Luke Stringer, Advanced Health Chiropractic, and we're talking about neck pain again. And a real common question that we get asked all the time from our patients is, why does my neck pain get worse with activity? And it's a great question, and we're going to answer that in just a moment. But before we get there, we should go over exactly how your spine and neck is designed to essentially function, and then we'll go over how that dysfunction creates all the pain that you're getting, particularly during exercise. So when you evaluate the spine from the side, you should be able to see your ear on top of your shoulder in a 40-degree curve. It's important to see this. Essentially, it's good posture. It's critical for health in general, but it carries the weight of your head nice and evenly in the posterior, and it displaces the weight nice and evenly into the back of our essentially joint, and it creates good weight bearing throughout the joint. And obviously the tissue is allowed to move in its full range of motion. It's stable. However, as we previously discussed, repetitive stresses in front of us, or big traumas like car accidents, and your spine shifts out of alignment, what happens is the soft tissue, the tissue that should look like this, then does this. And obviously, either if you've had a big impact like a car accident, it becomes damaged instantly, or repetitive stresses like sitting for 50 plus hours a week, over time that tissue breaks down. And when it breaks down, it specifically gets formed with a collagenous material called adhesion. And when adhesion is within a muscle, and where it starts, it finishes, or anywhere through the tissue, it essentially limits our range of motion, creates weakness in flexibility. So let's just touch on exactly what is adhesion and why it's so important to address. So when you evaluate tissue that hasn't had any trauma or repetitive stresses under a microscope, that biopsy, essentially, in layman's terms, it should just look really structured and uniform, that lattice formation. And when we see this, it allows the joint to move in its full range of motion, and it stabilizes the joint. However, when we have those traumas, the tissue just gets beaten up, and it starts to look like this. So obviously that's weakening flex, and the body's not going to allow you to essentially walk around with damaged tissue. It has to regenerate, right? So when it regenerates, it does so, but it fills in all these little gaps, these little tears, or big tears, depending on the trauma, with something called adhesion. It's collagen, it's scar tissue within a muscle. It's weak and inflexible. So essentially this forms in all the structures, or specific structures, should I say, within the neck that are designed to stabilize you and move you. So when you go to move the joint, i.e. exercise, might be lifting weights, going for a run, in the gym, hiking, when you require the joint to move, the tissue can't stabilize it, we obviously break down. And classic symptom we're going to get is pain in our neck, pain in our shoulders. And the second issue that forms around that postural shift and the formation of adhesion is essentially compensatory patterns. So when we have good posture, full range of motion, essentially we can function without pain, the muscles in the front of our neck, these neck flexors, are really active, and then the muscles that simply sit between our shoulder blades are really active. But again, through traumas, mainly repetitive stresses like sitting, the big muscles that anchor into your neck from your shoulders, your traps, some muscles that anchor your shoulder blades into your neck, they start to dominate, and your chest starts to dominate. And what happens is, as you go this way, those big muscles try to stabilize you. We call it upper cross syndrome. Your traps, your leviators, your SCM, and your pecs are going to get really dominant. And the little muscles, neck flexors, and all the muscles that are really important down here that sit between your shoulder blades become redundant because we don't use them. So then when we go to move, and those big muscles are essentially stabilizing you, all the little muscles, which are designed to keep you in good posture, more intrinsic movement, essentially subtle movements that stabilize you, switch off. And when we exercise with that compensatory pattern, essentially those big muscles don't do the job of the little muscles, and we start to compensate. And classically, when we start to compensate through exercise, we start breaking down, we start getting neck pain. So if you enjoy exercising, any form, and when you're exercising your neck pain is getting worse, or it feels worse during or after exercise, I encourage you to click the button at the bottom of this video, fill out the contact information. One of the team will be in touch with you really shortly. Let's get you in the office, give you a thorough evaluation, put in some goals for you to achieve, and let's get that neck pain corrected.